The Laschel instruments are based upon a few very basic concepts that are patented. One of those concepts is that a suture knot is a minimal factor of 3.2 times the thickness of a single strand of suture. This enables us to make a fail-safe suture cutter for the assistant. Now, during surgery, in every type of surgery, whether it's medical, dental, veterinary, or podiatric, the surgeon wants his assistant to cut it sometimes 2 millimeters above the knot, sometimes right on the knot. And most of the time, the area of surgery is very restricted, and visibility is restricted, and it's not very visible. The slot that we designed is thick enough to receive the suture, but when you slide it to the knot is too fat to go through the other side. Now, this blade never loses cover of the face, so it cannot cut anything that's not in the slot. It can only cut what is in the slot, and since only suture can fit into the slot, suture is the only thing that can be cut and not tissue. So with this, and even in a deep hole, as in a open heart surgery and a changing of a heart valve, the assistant slides the suture into the slot and slides the instrument down to the knot. The knot is too fat to go through the other side, and it leaves a perfect 2 millimeter tag. Now, there are different sizes of this, and as well, we make them straight for the plastic surgeon. Sometimes the plastic surgeon wants to cut the suture 2 millimeters above the knot, as they would want to in a tummy tuck or a reduction or augmented mammoplasty. And other times, when they're placing interrupted subcuticular sutures of the absorbable kind, where they want as minimal amount of suture sticking above the knot as possible, because the more suture that's there, the more serous exudate is formed, and sometimes it causes too much serous exudate, and some fluid comes out of the wound, and it appears that it might be an abscess, which it isn't. Now, when we make it straight, we can cut the suture, lead into the slot one way. It will leave 2 millimeters above the knot. Turn it around, and it will cut it right on the knot without cutting the knot. Because as you cut, it lifts up the suture and slides it away and cuts it right on the knot. Now, we've been able to take this concept and put it into all different sizes of needle holders. Now, one of the more popular ones is the 6-inch Mayo Hager. And the manner in which that would work is very, very quickly. And this is a great improvement over the Olsen Hager, or the Gillies, as it's called in plastic surgical markets, where the surgeon would tie the suture. Okay. Then, when he's finished, he puts the suture in both hands, slides the suture into the slot and slides it down to the knot and cuts. Or he can turn it around the other way and cut it right on the knot. We'll try that again. Now, if the surgeon wants to preserve suture material, and he has a lot and he doesn't of sutures to make, he can cut it like this. And he doesn't have to cut 2 at a time. He can cut 1 at a time. And cut like this, and then come back and cut this one. And it's just about the same size. But the important thing is that this blade is always protected. The blade never loses cover of the face. Now, also on the instrument are numbers and letters. this particular instrument reads 20 CGS 0/50. So this means that that slot size is 20 thousandths of an inch. It works with chromic gut and synthetic sutures 0 to 50 and silk 1 to 40. And the reason why silk has a different range than chromic gut and synthetic is because silk is a more compressible suture and makes a smaller knot. And that's why you have a wider range. But each slot size works with 5 continuous sizes of suture, either chromic gut and synthetic or silk. Now this is important also because there wouldn't be too much duplication. For instance, a dentist would never use sutures that are outside this range. For gynecology, where they would use something like this, this is also 20 thousandths, and that's geared for the those types of sutures. But in equine surgery, this one has a 28 thousandths of an inch slot and works with sutures of the entire range from number 4, not 40, number 4 to 20. So it covers a wider range of suture. Now, the next series of technologies that Laschel has developed are concentrated on why instruments work and why they fail. For instance, scissors. Scissors do not cut by cutting, they cut by shearing. Scissors don't fail because they get dull, they fail because they get loose. They get loose because 2 hardened blades come together under pressure. And that pressure is greater than the resistance provided by the screw or the rivet. So what happens is when these things continue to work over a period of 2 or 3 months, the doctor then has to go like this to antagonize the blades together so that the shear works. This is different. This is made out of spring material, whereby you can see that the blades have at least a 300% increase in shearing angle. And you can see that when you close the blades, these blades actually flex and straighten out. Now this is very advantageous because the scissors always cut on the point. One of the nice things is, now I'm going to take my glove off and I'm going to make this demonstration. One of the nice things about this is, if you have a suture that's buried like this, we ask the doctor, how would you remove that suture? Now, the answer, of course, is that you would have to give a local anesthetic or dig it out. But because these instruments are so light, they're actually lighter than titanium. Not because the density or the specific gravity is less, but because we've taken advantage of some very basic engineering principles, and we only need half as much material. So those engineering principles are, we've taken advantage of placing concavities and convexities in the instrument to make a flexible instrument stronger by adding the beam strength. And the beam strength comes from the convexities and concavities. Now, because this always cuts at the point, you can actually feel the suture. And when you feel the suture, you allow it to open. The scissors separates the edematous borders. You re-advance it and cut it. Re-advance it and cut it. Now, in terms of forceps or other instruments that might be needed in veterinary surgery, we have this forceps, which is probably one of our most multifunctional instruments in the field of dentistry because it serves so many purposes. But in the field of veterinary surgery, in exotics, this forceps is so flexible that, and also by adding the carbide inserts, we can actually take out rabbit's teeth by grasping onto it. Now, if I put that kind of pressure on a regular forceps, first of all, it has a tremendous grasp, but also it doesn't splay. You'll notice that I just grabbed onto something probably about 5 times thicker than the thickest needle, but when I close it again, there's no splaying. This splaying occurs in every other instrument, but in flexible steel, it doesn't occur.